October, as you know, is a time of year when many of us associate with masks. But some people may feel like they're hiding behind a mask every day. They're masking their feelings of pain and suffering caused by an autoimmune condition called psoriatic arthritis, which you, of course, are an expert in. Here to explain what psoriatic arthritis is and what's being done to help improve the lives of people living with this disease is Dr. Amar Majjhoo, a rheumatologist and member of the Global Psoriatic Arthritis Narrative Advisory Committee. So, again, hello to you.
Hello, good morning. Thank you for having me on.
Okay. As I said, this month is known for masks. But why do some people with certain illnesses hide behind a mask all year?
So, the best way I can think about this is that life is challenging for all of us. For you, myself, people living without disease, we have responsibilities. We have life. We have to work. We have to deal with our bosses, people at work. We have interpersonal relationships. We have demands. We may have children, aging parents, and so forth. This is challenging even for people without disease. Now, people with psoriatic arthritis have a chronic autoinflammatory disease that can affect a variety of organ systems. So they can have skin involvement, nail involvement, musculoskeletal involvement, causing pain, stiffness, swelling, discomfort. And you can imagine that this causes a certain degree of challenge for people to deal with everyday activities. Oftentimes patients feel like they need to hide these just to try to keep up with these demands. So they're trying to be the way they used to be before their symptoms started, or perhaps just the demands around them. People are expecting them to do the kinds of things that they did before they actually were affected by disease.
Okay. And how does it impact on their daily life?
So again, there's a multitude of different symptoms that can be involved in this disease. So patients can have skin involvement. You can imagine that there may be negative impact both emotionally and mentally because of the cosmetic nature of skin involvement. But the skin involvement can also cause itching and discomfort. They can have nail involvement, which again can affect their mental well-being because of the cosmetic, especially if they're in sales or something like that. And then certainly musculoskeletal symptoms. They have neck pain and back pain and joint pain and stiffness and loss of function. They can have pain in their enthesis, so tennis elbow, golfer's elbow, Achilles tendonitis, plantar fasciitis. All of these symptoms you can imagine can affect them negatively in terms of everyday activities. In fact, in our PSA narrative, over 9 out of 10 patients reported a negative impact on their emotional and mental well-being.
You mentioned cosmetic several times. Could you just comment on the cosmetic effect?
Yes, in my experience, it can vary, and certainly the degree of skin or nail involvement can vary, and how people react to that can vary. But you can imagine that there is a certain degree of negative impact emotionally, mentally, because of the cosmetic. They can have redness of their skin, scaling of the skin. They can have scaling, from their scalp and so forth. So this can have a negative impact in that regards.
Okay, and as a result, so it's sort of throughout the body. Would you say it affects the body as a whole?
Yes, it's a systemic disease, and it can have many different features, clinical features, some of which we talked about. And patients can have other symptoms, such as fatigue, which can be related to the disease itself.
And arthritis, too?
Yes, so the musculoskeletal symptoms, they're a very prominent feature of the disease. And again, patients can have pain, stiffness, and swelling. And I invite patients to learn more about their disease in order to get better care. So one of the sites that they can visit is the National Psoriasis Foundation's website, and that site is psoriasis.org, where they can
Let's go, slow down. Let's get that site again.
Oh, yes. So that is the National Psoriasis Foundation website, and that's psoriasis.org.
So the actual is www.psoriasis.org?
www.psoriasis.org, correct.
Okay, that's good. Okay, and then they can get more information about psoriatic arthritis.
Correct. They can learn more about the symptoms that they may be experiencing.
What would you say? Is arthritis the most common side effect of or complication of psoriasis?
So it's estimated that 30% of patients with psoriasis, skin psoriasis, or what we call PSO, have psoriatic arthritis. Now that's different than the wear and tear type of arthritis that many people experience, that we call osteoarthritis or degenerative joint disease. These people have a different type of autoimmune type of arthritis that's affecting their spine and their peripheral joints, and as well as other areas.
Okay, but the psoriatic arthritis is the one that is most commonly associated with psoriasis.
The vast majority of patients that have musculoskeletal complaints that have psoriasis are more than likely to have osteoarthritis, but a portion of those patients, probably about 30%, have what we call psoriatic arthritis, which is different. And, I would invite people to learn about the differences and the symptoms they're having by visiting that website, psoriasis.org, and to learn more about our PSA narrative, which is a global initiative created by Pfizer to learn more about the unique complexities that patients with psoriatic arthritis are living with. They can visit that website as well, and that's Pfizer.com/PSA narrative.
Okay, but the one that we really want people to know is most convenient and easy for them to get to and associated with the condition is psoriasis.org.
They can learn about the disease at psoriasis.org, and they can learn more about the PSA narrative, where we've learned a lot about the issues that patients that are living with this disease have reported, and that's, again, Pfizer.com/PSA narrative. I thank you so much for having me on this morning and learning more about the disease.
Yes, and I want to thank you. I'm sure my Health Power audience will benefit from this information.
I'm really hoping so. Thank you.
Okay.